Thursday marked day 2 of the rollout of the second doses of COVID-19 vaccines in the selected coronavirus hotspots across the country. Despite the hitches that characterize day 1, the Ghana Health Service says more than 17,000 people got their second jabs on Wednesday. Though the process has been smooth in most places, there have been pockets of misunderstanding and frustrations at some vaccination centers. Erastus Asaridonko has been monitoring the process in the Ashanti region capital Kumasi and joins me via Zoom with his observations. Hello, Erastus. Has vaccination started after lack of materials hindered its progress on day 1?
Yes, vaccination started today. The first day was characterized by the lack of certain materials, especially the new card with a hologram to be issued to, and when it came, the data system to really input the data of people in was not available, it was not working, and so they had to stop abruptly the registration. And so today, when we went to many of the centers, especially the KNUST hospital, over 5 queuing to get their jobs. And so it resulted in name calling and verbal exchanges in the people who were trying to take over or not join the queue or get their jobs very fast. That is what characterized the exercise today.
So we're talking about frustrations. What really caused the frustration among patrons at some of the centers you visited?
In fact, it was the slow nature, extremely slow nature of registering and inputting data of those who had come to take the jab into the system. They had only one tablet and one person registering over 500 people, and it took a long time to finish with one person. So people had to stay in a queue for a very long time. And, you know, some of them have been there since 5 a.m. at that day, so attentions were high.
That is Erastus Asaridonko, our correspondent in the Ashanti region. Let's listen to some people he spoke with on the ground.
I'll show you the document that I'm 76 and a half years old. And I am a Ghanaian on top, and I'm 48 Ghana in Kumasi here. And why I should be prosecuted because of cola?
So how long have you been here?
48 years.
No, how long have you been here today?
This morning I come around 6:30 again. Yesterday I came 20 to 6. We left from here 5 o'clock just to be promised something, and it is not true.
What do you think is the problem?
Me, I don't know. Nobody tells us exact problem, so we don't know. We only know we are going to work for you people, that's all.
So the confusion you see here is as a result of lots of people cramming up here trying to get vaccinated. They are supposed to go through a registration process to get their names and their details into the system before they can be vaccinated. Now, it is only one gadget brought in by the Forikrom Municipal Health Authority. That is this gadget in front of this gentleman to do that particular registration. So the registration is going at a snail pace, thereby people remaining seated for a very long time, and that is what is creating this confusion. Now, the KNUST hospital is trying to support by recruiting these nurses. They have downloaded the software themselves and are using their personal phones to assist in the registration so it can go faster.
Well, joining us now from the Ghana Health Service is Dr. Kwame Aponso-Achiano. He is with the expanded program on immunization at the service. Thank you so much, Dr. Achiano, for joining us. We're learning over 17,000 people were inoculated on day 1 of the second dose rollout. Do we have a figure yet for day 2?
Thank you very much, Aisha. Yes, As at 3 p.m., first of all, my greetings to your cherished viewers and listeners. I am in Kumasi myself, and as at 3 p.m., we have had approximately 28,000 people vaccinated across those targeted districts. But it's early days yet. By the close of the day, where close of day means after this news broadcast, I believe that we will get updates, and therefore we can have a better figure for you tomorrow. I've just retired home, and we are interacting with our colleagues who went to the field to get some updates from them as well.
I'm sure you heard from our reporter from Kumasi who talked about frustration at some centers. What seems to be the challenge with some of the centers, particularly in Kumasi?
Well, I am in Kumasi myself, and to be frank with you, this is not reflective of Kumasi or the Ashanti region at all. At least I was in KCCR, together with the rep of the WHO and the country rep and colleagues from WHO as well, the regional director of health services himself, the deputy director of public health of Ashanti region, the UNICEF chief of health and nutrition. We're all in the field, and we never witnessed what your reporter picked up. We sympathize with them. To be frank with you, we actually estimated that each team vaccinates approximately 80 to 100 persons. So for 500 persons, I think it's more of a local problem. That shouldn't happen at all, because that is not within our plan. And as you said, it's just one side. So that means that it's just a team. And we never estimated anything above 100 for any team at all. So we really empathize with the people. But our thinking is that people probably are thinking that the vaccines may get depleted. That's why they are rushing to the centers. And so we want to assure them that once they had their vaccination, the first dose from the 1st to the 9th of March, their vaccines are reserved. And so they should be calm. They shouldn't crowd the place. And for us, the unit of operation is the district. And so we leave the district to do their micro plans and, as it were, stagger the vaccination for their people as much as possible.
But there are some, though, who have received their text messages all right, except some of them say they are being asked to go for their second jabs at some other places different from where they took the first jab. Most importantly, they say the places are unknown to them. Is there a way they can get clarity? For instance, a number they could call?
Okay, so the traditional hotline for COVID-19 issues, including vaccination, is 112, but they can share some of these things on the various social media handles that is being handled by the Ghana Health Service. But of course, as I stated earlier, the unit of operation is a district, and so they have to have a recourse to the district health directorate if they have any issues. We would only help them. We can only support from the national level, but there's a limit to which we can do that kind. We can give that kind of support. Again, the unit of operation is a district, and so we leave the district to do their planning, and therefore we would advise that anybody who has had a test message should rather go to the place where they had their vaccine the first time, and that will be sorted out better for them.
So there's no, a center, a control center where you can just call and channel your grievances?
So I have mentioned that the hotline is 112. So, but as I said, because the unit of operation is a district, it is better to tackle this at the district level. Because remember, we are doing 360,000. Assuming 60,000 people call one center, it won't work. That is why it is decentralized, so that it is manageable. When you are dealing with fewer people, complaints that are decentralized, it will be better than one side dealing with 20,000 people at the same. That may even bring more chaos.
Okay.
And so we urge people, they should be calm. They contact the district health directorate. Every facility, every vaccination site is situated within a district. And that is where we would like them to channel all their grievances.
Dr. Chano, there's a question from a viewer which reads, per the nature of work some people are doing, they took their first jab in the Upper East region, but now they're fully here in Accra. The nurses told them unless they travel back to Upper East region, they cannot get the second jab. Why can't they receive the jab here once they have the injection card and all other identifications here?
Okay, so let me clarify one thing. Remember, those who are due for the second dose are people who receive their first doses from the 1st to the 9th of March. We did Upper East in April. And so therefore, anybody from Upper East who says he's vaccinated is not due yet. And so this issue doesn't arise at all. We started with the 43 hotspots. And these 43 hotspots, none of them is in Upper East. It's 25 in Greater Accra, 16 in Ashanti, and 2 in Central. So any other thing, I don't think even warrants consideration. When they are due, they would also receive their vaccine.
But so if the person is within the 1st to 9th March and is from Upper East, can they take their second jabs in Accra, for instance?
It is not going to be possible for anybody in Upper East to have received a vaccine from 1st to 9th. Unless the person is from Upper East and was probably in any of the 43 districts.
I'm just using that as an example. Even if it's in Ashanti region and the person finds himself now in Accra, can that happen?
Okay, so I think that we need to be more practical. Otherwise, we will create confusion.
Okay.
We started with 43 hotspot districts. These hotspot districts are in Greater Accra region, Ashanti, and Central. Let me emphasize. We have 25 in Greater Accra, 16 in Ashanti, and 2 in Central.
Okay.
Of course, if you're a resident of Upper East and you found yourself in Accra or Kumasi, or for that matter, Ewutu, of course, you are also a Ghanaian and you would benefit from the vaccines that were being given to the hotspot areas. But to say that you were in Upper East and you were vaccinated from 1st to 9th, please, it is not true.
Okay.
We never distributed any vaccine.
Okay.
However, to answer your substantive question, if on a rare occasion somebody took a vaccine in Ashanti and finds himself or herself in Accra, there's still the opportunity for that person to be vaccinated. And so that shouldn't also create any problem. But of course, they need to exercise patience because originally, remember, in sharing the logistics, we considered the district populations. And therefore, if you cross over, you need to be extra patient and wait for a turn, explain your issues, they would understand, your name will be in the database and they will vaccinate you appropriately. I'm
grateful for your time. Dr. Chiano is with the Ghana Health
But I have
Service.
updates. I just received updates that we've done approximately 54,453 across the country.
Okay, for day 1 and 2.
For the second dose.
Thank you so much, Dr. Chiano, for your time.